We're brought to you by Richard's Honda, home of the warm and fuzzy feeling. Joining us now, Dr. Stephen Etheredge, who is a weekly contributor here on Hangin With Hester and Hanny. Doc, how you doing?
Doing well, guys. How y'all doing today?
We're doing good. Take us to med school for 90 seconds. Explain what myocarditis is.
Yeah, I don't know that we've talked more about this than the past couple of days, but so myocarditis is a well recognized but not often well understood condition where something causes inflammation of the heart muscle. By definition, that's what myo is, the heart muscle. Carditis, that's the inflammation of the myocardial muscle. So usually we know that it is viral causes. It's one of those things, though, where it's not always perfectly understood. There's a lot of other things, sometimes medication, sometimes genetic predisposition. But we do recognize that there are multiple viruses out there that rarely cause this. And when it does, it can be a pretty significant heart condition that can result.
When we hear it's rare, Dr. Etheredge, right, and it's a rare condition, how rare is it? Could you put a number on it? Is it something that when you see it, it kind of makes you wonder, oh, okay, well, this is so rare that I need to call somebody and have this conversation?
Well, definitely yes to that last category. You know, as far as how rare it is, like, you know, to be honest with you, it's something that most of us see very, very infrequently. And in all reality, I think, you know, I've talked to some of our cardiologists about this. We've discussed it. We've been doing our due diligence here. And really, more often than not, what will happen is you'll see an otherwise healthy, say, 30-year-old individual who all of a sudden presents with heart failure, meaning that their heart is no longer pumping as effectively as it should, especially for someone in their age and demographic. We oftentimes just assume that they had a viral myocarditis in that scenario, because the problem is it's very hard to catch sometimes. This is something that is often caught in the aftermath, because what can sometimes happen outside the really severe cases is that you see it down the road when people present with cardiac problems. Now, in the acute setting, when you do catch it urgently, it often will present similar to somebody who's having a heart attack. They'll often have chest pain, shortness of breath. They'll feel palpitations. Sometimes there are diagnostic changes that we look for in their blood work on an EKG. Sometimes even get, an echocardiogram, which is basically an ultrasound of the heart. So we can detect it those ways. But more often than not, it's something that we often just assume, and then we look back in the patient's history, and maybe they had this really bad viral illness 6 months, a year, 10 years earlier. And I think that's where this concern is coming in with this COVID virus, is that are we worried that it's going to cause this either acutely or down the road?
Is it standard procedure to order an echocardiogram for somebody who has had COVID if they're not showing any other symptoms of the heart?
Currently, that is not, and really not for any viral condition. The problem is we know there are viruses out there that cause this. Influenza, hepatitis, some of the common cold viruses even cause this. In fact, some of these what are called enteroviruses are the ones that are the most common. And these, generally speaking, do not cause it. It is a very, very rare thing. Most of us will never know somebody who experiences this, we hope. It's that rare that you probably don't know anybody that ever has or ever will have this. At least if you look at what we know is going on out there, and in sports, we do see this happen. Even prior to COVID-19, on occasion, you'll hear of a story of a kid somewhere that had some type of a cardiomyopathy. In fact, when these kids come into LSU, part of our screening protocols, we do get an echocardiogram. A lot of your big colleges are now doing that. It's not a requirement, but we do try and go and do everything we can to look for maybe something happened in your lifetime that no one picked up on. But right now, this is not your typical screening for really anyone.
I don't want to be callous to the subject, but what does an echocardiogram cost?
That is a good question. You know what? I don't ever look at the bills, if you want to be honest. I know a lot of times for some of these screening, I will say that a lot of the cardiologists here locally, I know in other places, especially when we're talking about sports, they will often work with a lot of the, whether it be the high schools around here, there are programs where we can get echocardiograms if they don't have good insurance or they're unable to get it done. There are a lot of the cardiologists who've been very generous of their time and their resources, and they'll usually do them for either for free or for nothing. In those scenarios, obviously we all aren't that fortunate, but yeah, they're not cheap.
Yeah, and so we were talking earlier before you came on. Not everybody has that resource to be able to do that, and I guess I want to kind of ask, what would you? Is there something that you can see on the field, or something? Is there a pain, or is there something the player can kind of tell you to make you go and pull that test, or is it something that you just have to catch when they come in or throughout the time when you do it?
Well, there are things you look for. I mentioned some of these typical cardiovascular conditions. So obviously, right out of the gate, chest pain and shortness of breath. And of course, we've all been there. You're running. Of course, you get some tightness in the chest, but something that's beyond what is normal. And especially in somebody who is a trained athlete, if they're struggling more than normal, could it just be they're out of shape? Maybe they missed some time, especially the ones who did maybe have a previous COVID infection. Perhaps they just were down for a couple of weeks on top of maybe not doing the best in the off season or whatever. So in those scenarios, we have to take it seriously. But I think the one thing that I stress to people at any level of athletics is say, look, right now, or really any time, you should never just say, oh, he's just not being tough. You got to always assume the worst, and then you work your way back from there. So, we've all been there, like I said. But so for me, the first thing is, are they having chest pain, shortness of breath? And especially if this is something that is different, it's a lot easier in some of these college athletes because they're well-tuned athletes. They know their bodies very well. So in most of these, if they come to me and say, hey, I just don't feel right, well, for me, that immediately raises concerns. And I can tell you, a lot of what we're doing right now, and every college is different right now with how we're handling it. But we are screening all of our guys when they come back. We're doing symptom checklists where we're letting our strength coaches know that these are the guys that have had it. Watch them more closely and don't just necessarily jump on if they're kind of lagging. Then we need to know about that. We are getting EKGs on all of them before they return to sport. We're adding more and more to this as we understand, and it's hard to know even if this is overkill. Realistically, this is such a new thing. I think you can make the argument that myocarditis has been around for a long time. Is it going to be any worse with this virus than others? We don't know, but we are taking, severe precautions. I can tell you, I've done lots of research. We've looked at a lot of these guys. We're, reaching out to the experts all around the world and trying to make sure we're keeping these guys safe.
Doctor, forgive me for the simplicity of the question, but is there any link that the COVID actually triggers the myocarditis?
We think there probably is a correlation there, to be fair. But to be fair, that is also true, like I said, of multiple other viruses. We know that in those who are really sick, the ones who end up in the hospital, that there's a very high percentage of those individuals who do suffer heart damage. But again, they also are very easy to catch because they are very sick. They're in the hospital. So the question is, in these, asymptomatic individuals or these very mild symptom individuals, is there any increased risk? And, right now, the data suggests that while it may be happening, it doesn't show that it's happening in any high numbers yet. Now we have to follow up on this data. But outside those really sick individuals, I think most of these people, it's probably going to be a comparable risk to other viruses. Maybe it'll be a little bit higher. We don't know. Obviously, it would be great to have that crystal ball, but right now we're not seeing it, at least very, very high percentages.
One of these days we'll get around to asking you about high ankle sprains again, but not today. Dr. Stephen Etheredge, thank you so much for your time. We'll talk to you soon.
My pleasure.
Back on the other side, Hanging with Hester and Hanny, 104.5 ESPN Baton Rouge.